Welcome, welcome, welcome. We are grateful for you, whether you are able to participate live here today or you're catching this recording later on. We're grateful for your contributions, whatever they are, in our community to having a healthy and well place for everyone involved. And so hopefully today we're going to bring forth some information that may help expand the awareness for you of where you can refer people, or even things in your own conversations that may inform and improve the way that you can disseminate information. And so we do thank you for your participation, for your support of the community. I am Kevin Ressler. I'm president and CEO of United Way of Lancaster County. We enjoy having these monthly conversations about our community, covering a wide variety of topics, but within our focus areas of education, economic mobility, health and wellness, as well as capacity building and equities is a focus that we continue to drive into as well. And so this morning here, or I guess afternoon, days flying by, this afternoon here, I'm really grateful for a host of different panelists who I've interacted with in various ways and have been continually impressed by their excellence in different areas of our community and ways in which they help us to see more clearly, more widely, the individuals that we too often have created a narrow band and forgotten in spaces of wellness, and whether that's through some of their professional, personal experiences or otherwise. I think that this is a greatly assembled group of individuals for you all to be able to learn from today. And also a reminder that later on, so we'll start with a panel, as we often do, a presentation, we'll move into a panel. And then during that panel, that's when you've got the question and answer section down there, chat. Please feel free to be engaged, help shape the conversation that we have today. And so I'm going to go ahead and call out one by one our panelists, and then we'll move into our presentation. So my friend, Dr. Cherise Hamblin, if you would like to begin.
Hi, everyone. I'm Cherise Hamblin. I am an OBGYN with Penn Medicine Lancaster General Health, and I'm the founder of Patients Are Waiting, which is a nonprofit organization. Our mission is to eliminate health disparities by increasing diversity in medicine through 3 areas of focus: increasing the pipeline of minority clinicians, making that pipeline less leaky, and supporting minority clinicians in practice. Thank you so much for having me.
Thank you. And my brother, Giovanni.
Hello, everyone. Giovanni Vedoya, owner of Red Tie Affairs and Diversity Mixers. So we do all kinds of entertainment, fun events, planning, and then the diversity mixer side is the business consulting, specifically Black and Brown owned businesses, minority owned businesses, networking events, and anything that has to do with project management, DE&I, anything that can help our community grow and succeed. Thank you for having me.
Thank you. And my wonderful, wonderful friend in combat and good trouble, Reverend Mandy.
Hi, I'm Mandy Mastros. I'm the pastor at the Moravian Center of Lancaster. I'm the chaplain for our adult day program, which I'll share a little bit about later, which serves individuals in the community with memory support needs. I also do outreach for the unsheltered individuals in Lancaster City with a great team of people there. So thank you.
Thank you. And so at this point, you all can sort of mute and drop off your video. The last person that I'm going to welcome will be our presenter. She'll also join the panel, but be our presenter here. And I have been just inspired, Jackie, as I've watched from a leadership perspective, how you and Elisa have merged 2 historic organizations to become more powerful, and just continually just really personally touched by the way in which I watch your compassion always showing through in an empathetic way. And so thank you for the work that you are doing at the Federally Qualified Health Center, which I'll let you introduce. But just to mention that yesterday, my daughter went to Union Community Care the first time. As I learned this recently, we have insurance, but the Union Community Care also accepts individuals with insurance. And so we said, you know what, this is the closest health clinic to us, and they have excellent services. So we're beginning to migrate our family services to your excellent facility. So without further ado, go ahead and introduce.
Well, good afternoon, everyone. My name is Jackie Concepcion. I am the Vice President of Health Center Operations at Union Community Care. A little bit about Union Community Care. We are a federally qualified health center. We operate in the city of Lancaster, also Lancaster County and New Holland, and also in Lebanon. Together, we serve about 36,000 patients. Our focus, of course, is the underserved communities throughout our county and in Lebanon. We, like Kevin just said, we do primarily serve the Medicaid population. However, we do accept all insurances. And actually, we also serve people that are not insured through the ability of a 340 grant that we receive from the federal government. We're able to provide a sliding fee scale for those that are uninsured. So in a nutshell, that is who we are. Like he said, we are a combined organization that merged a year and a half ago from Welsh Mountain and Lancaster Health Centers. I'm very excited to be here with you all today to talk a little bit about our community. And I am going to now share my screen. Hold on a second. Can everyone see that?
Yep, you're good.
I'm good. Okay, so one of our really strongest point that we want to make in our community in terms of our brand and who we are is that we stand for you. All of our branding reflects this, because this is truly what is our vision at Union Community Care, is that we're here to support our community, to be there for them in times when they need us the most. So I was asked to talk a little bit of how is our community doing. So we, as all of you know, are just coming out of the biggest pandemic that has hit our country, actually not just our country, the world, in recent years, where many lives were lost, where we realized how inequitable our healthcare system is, because we saw so many people that were affected. The most were those people that fall in that category of underserved communities. So I recently, Lancaster General Hospital and WellSpan put together the community needs assessment for our area, Lancaster County. And I just went through it and took out some of the areas that I thought are areas that continue to be an area that needs improvement. So although our community, we're getting back to normal, our unemployment rates are going down, people are getting back and to somewhat of a normal life. They're getting back out in the community, outdoors. The summer was pretty active. We know that there is still a lot of COVID out there. There's still a lot of people being infected. Of course, people are not dying at the rates that they were initially. They're not getting as sick, and a lot of people are vaccinated. We continue to push the message of getting vaccinated, especially now that vaccines are available for young children, and we are very active in promoting that. But let's get into how is our community doing. Well, in looking at the needs assessment, access to care in our community indicated that 291 out of 988 participants reported there was at least a lot of times where they did not get care. Reported that there was a time in the last 12 months when they needed care but did not receive it. Specifically, and I'm not going to bore you with details with numbers, but you can read them. 15.6% reported they delayed medical care, they delayed dental care, and they delayed mental health or substance use treatment. This is really important because those are the areas, at least for Union, that we focus on the most: dental care, behavioral health, and medical care. And we're seeing people delaying their care because of the most common reason was cost, inability to get an appointment soon enough, and worries about COVID-19. The worry of COVID-19 is decreasing, but there's still that inability to get an appointment at the time that they wanted, but the one that touched me the most was the most common reason, which was cost of care. Other issues included inconvenient hours, transportation barriers, and this seems to be a huge barrier, especially out in the county. I know within the city, for example, we have 4 sites. We have one at Southeast, we have one at Brightside, we have one Grandview, and we have one right downtown. So people can, most of our patients are able to walk to one of our sites, if not take a bus. But when you look out into the county, for example, our New Holland site, transportation is a huge barrier. Why? The buses don't go everywhere. They don't have a regular hourly time that they go, and they only go down the main street. And I think they stop at 5 o'clock. So transportation is a huge barrier for people to get to their appointments. So what we heard from people, according to the needs assessment, is that they want to reduce the cost of care. And they want to learn and understand better how to navigate services. And they want improved health insurance coverage. So I'm going to go into dental care. Because we at Union, and this comes dear close to us, because dental care was one of the hardest hit programs that during the pandemic. Dental care was actually shut down for months. And in trying to rebuild dental care and reopen dental care, what we have found out is that there's such a shortage of dentists and a shortage of support staff that we cannot keep up. So we have lost about 2,000 patients that we don't think are just lost, that these are people that are just not getting care. And that's a straight result of what happened during the pandemic. We know that in Lancaster County, the ratios of dentists to people needing care are just not enough. We cannot keep we open our schedules sometimes, and within a couple of hours, they're full. And our ability to recruit dental staff has been quite difficult. Health insurance coverage. This is another area that we heard was huge. What we're hearing is that adults with health insurance, over 87% of adults in Lancaster County have insurance, but the problem is having insurance that covers them well. Insurance that they can go to the doctor without a high copay or a very, very high, what's it called? When your overall care that you can afford. So for example, if I have health insurance and I have to go get x-rays and blood work, that usually goes uncovered in my health insurance until I meet my deductible. My deductible can be $2,000, $5,000. For me, $2,500. For my family, $5,000. Most likely in a year, I'm not going to be able to meet that deductible. So we are hearing that a lot of health insurance coverage is needed. But what worried me the most about these numbers was the kids that were uninsured. The groups with the highest need for insurance in Lancaster are, guess what? Children under the age of 6. That is incredibly high. And we have so many resources. For example, they may qualify for Medicaid, they may qualify for Blue Chip, but sometimes not knowing how to navigate the system is just as important because parents don't know of all the resources. Mental health. So we all know mental health issues have skyrocketed. So we saw a decrease in people getting mental health services during pandemic, but that doesn't mean that the mental health issues have decreased. So what we're looking at in mental health is that mental health providers are very scarce. Right now, we don't have enough psychiatrists, psychologists, licensed clinical social workers to meet the demand that is existing. We know there are a lot of people right now experiencing mental health issues. We're seeing poor mental health days. 31% of adults in Lancaster County are experiencing at least one poor mental health day in the past 30 days. And what I want to talk about with mental health is that mental health right now is because of the shortage of providers, people are going untreated for long periods of time, which is also exasperating their mental health needs. Another topic was obesity. So currently 31% of adults in Lancaster County have obesity, and this percentage has increased over time. So we're not getting better in Lancaster County when it comes to obesity. Although it's not significant, it's not better. In Pennsylvania, 32% of adults have obesity. The areas in the metropolitan area surrounding Lancaster City have the lowest rates of adult obesity, but in general, most areas of the county have a similar challenge, especially among children in grades K through 6. Again, our children experiencing obesity, that leads to poor health outcomes as they become young adults. Diabetes, again, is another priority. In Lancaster County, 13% of adults have diabetes, which is pretty high. And that increased from 9% from 2011 to 2013. We focus a lot on diabetes because diabetes can lead to other poor health issues. And I want to say that we at Union, we are trying so hard to address diabetes. It's a very difficult because if people are not doing what they're supposed to, eating the right thing. So it's a matter of education. So we have pre-diabetes program where we're looking at treating people before we know that they're almost at the verge of getting diabetes. So we have some pre-diabetes program. We're in the beginning of starting a pilot called Veggie RX program where we're going to do diabetes education, and then people get coupons so they can get fresh vegetables, helping them to learn how to cook healthy meals, how to become more active. A lot of work around diabetes. Social needs. So addressing social determinants of health has become very popular. I believe, me, especially my background is as a social worker, I truly believe that you have to look at the whole person, and addressing social needs or the social determinants of health, looking at the person as a whole, what is affecting them. What is it? Just poverty? Is it education? Is it low income? Is it housing? Well, what we know here in Lancaster County is that it's a combination of all of that. If you look at people trying to find affordable housing in Lancaster, it's very difficult. The rents have skyrocketed in the past decade, and it's very difficult for people to maintain an affordable housing. Getting food, whether, sometimes they may qualify for food stamps for a short period of time, and then they get a job and they're making a little bit more money, and guess what? They now can't qualify for food stamps. So they have to stretch their money more. And food, as we all know, with inflation, is going up. I went to the supermarket the other day, and $200, and I could count like 3 or 4 bags that I had in my cart, and I was like, what's going on? So we are in a situation where there's a multiple social economic indicators that are affecting people moving in the direction of becoming healthier, because all of that does affect their health. Nutrition and food security, I just talked a little bit about that, how hunger, according to most recent estimates, 9% of adults in Lancaster and 11.7% of children are food insecure. That's pretty significant, especially among children. Feeding America has also released projected food insecurity rates for 2020 and 2021 for adults. These estimated rates are even higher, 11.9 and so on. So we are seeing more and more food insecurity. Access to food in Lancaster County is estimated to be 235,000 people who don't live within a half mile of a grocery store. So I talked earlier about that transportation, especially when you live outside of the city, I'm not talking about rural America. I'm talking about just maybe even the suburban areas. So if you have issues with transportation, it's going to be harder for you to access grocery stores within a good mile. And if you don't have that transportation and you can't get there, it's even harder for those low income populations. So I wanted, those are the ones that and if you get a chance to really dig through the needs assessment, there are more things there. But I chose those because those are the ones that I think in our community, especially here in Lancaster, we as a community should target. And I think there's so many organizations that are doing fantastic work around this, but there's so much more that needs to happen. So we are at Union, our model of care is that we believe in whole health. That means we want to address and heal disease, but equally important, work at the causes of the causes, the social ills that must be addressed to achieve true equity. And one of the things that I realized in reading through the needs assessment is how inequity in healthcare affects the outcomes that we are seeing. So we still know that racism is very prevalent in our community, and access to good healthcare applies and affects everyone, especially those that are underserved. So we are looking at a model of care that truly achieves equity. Our network of care is to provide primary medical, dental, behavioral health, those social support. We've added social workers at all of our sites. We've added like 9 or 10 social workers because we know how hard it is for people to learn to navigate the system. We are seeing more and more people apply for a sliding fee discount because like I said, those co-pays and those deductibles are too high. We also have a pharmacy program for people that can't afford their prescription because it's too high. So those are all the things that I think affect our community and prevent our community from being healthy. So together we look at moving forward. We don't let these barriers to care distract us or derail us. We look at all of our partners to continue moving the wellness of our community, because we know that each individual plays a role in having a healthy community. So it's not just a small group, it's everybody. And if we work towards everybody being healthy, that's when we're going to achieve healthy communities. So forward, onward and forward, we always say at Union, regardless of the barriers that we face. So I'm going to stop sharing and give it back to Kevin.
Well, thank you, and I'll invite my fellow panelists up here. And thank you, Jackie, for that. There was a question in there about whether or not the slides will be provided, and I'll just verbalize that we can send those out, but the whole video will be available in the coming days. There we go. I was like, y'all don't leave me out here by myself. No one wants to hear me talk that much. All right. And do not know if Dr. Latinia Shell has been able to get in here. She had some conflicts towards the end of the day here. We were just communicating with her. So she'll join in, but if possible. But so we're gonna move into a conversation here. Oh, you are here. So can you speak? Oh, you know what, Dr. Shell, I'm gonna have Olivia from our team reach out to you directly. Make sure that you have the correct link to be on the webinar side of this conversation. You might be logged in just as a, oh wait, there we go. There you are. Excellent, excellent. Welcome, Dr. Shell. We had gone around with the panelists introducing themselves before the presentation, so I will invite you, if you would like to go ahead and introduce yourself to our audience here.
Can you all hear me?
Yep, we're good.
Okay, give me 1 second. I'm getting a lot of pop-ups here. Okay. All right, I'm sorry. Can you repeat the question? I didn't hear
Well,
you.
just go ahead and introduce yourself. The rest of us had introduced ourselves before the presentation, and I knew you had a client running up against the start time. So if you want to just introduce yourself to our audience today.
Sure, yes. Hello, everybody. My name is Dr. Latinia Shell, and I am honored to be with you all today to discuss wellness. I am the owner of Diversity Works, which is a small group private practice here in the city of Lancaster. This is my 9th year in terms of being in private practice. In addition, I do teach. I'm a full-time assistant professor at Grand Canyon University, and I teach graduate level students who are in school counseling and clinical mental health programs. I am a proud mother of a now senior in high school. And so I'm very busy trying to run around to my son's soccer games, basketball games, and everything else. So, but I'm honored to be here with you all. And I do apologize for my lateness, but thank you for having me.
Yeah, no, understood. We are all very busy, and I'm grateful. Again, we're very grateful for you all's time here and those of you who are attending. So thank you, Jackie, for that. And we're going to get the link out here to everyone for the health assessment that Jackie was referencing. My colleague here, Olivia, will get that set up so we can send it to everyone. And it's a lot of information, and those health assessments are done every 3 years. And so they're a constant source for us at United Way and other organizations to be taking a look at. Where is the community health and wellness? And of course, because of the social determinants of health, those are often looked at more than just sort of like very specific health outcomes, but about community health outcomes. One of our panelists here who does work for LG, Dr. Hamblin, you talked about both in your introduction and what you've talked about a lot with us before in other conversations, is this sort of concept around who is providing care. Can you talk about why it matters? Like, what does it matter if my doctor is Black or white or, right? I just care that they're excellent at their job, right? Help us understand why diversity matters, not just, from the patient side, but from the provider side.
Of course. So it's very interesting because I think that there's some intuitive thoughts about it. Say, well, maybe people have more connection if they have a shared language or they have a shared experience. But in medicine, it actually is now the data is out there. There's several studies, for example, that the survival of Black infants is higher when Black infants are cared for by Black pediatricians. That primary care recommendations are more adhered to and accepted for Black adult men when their care provider, their doctor is Black. And so you start to go and kind of try to peel back the layers of what is behind racial health disparities. I've been a doctor for almost 20 years now, and that's kind of wild to say, but and I can remember going through medical school and learning all of the ways that I was going to die faster and younger and worse than anyone else. And there was so long that in medicine, being Black was pathologized, that there's something just different about being Black. And what we know now is that it is the experience of being Black, the experience of racism that shows itself in many different ways in the outcomes, whether it is about disparate access to care, whether it is about disparate treatment, it is racism, not race, that creates racial health disparities.
So that's helpful. We'll be talking in some coming months about some racial equity profile work that we've been doing at United Way in partnership with others like the Chamber and the YWCA. And one of the things that will come out there with regards to education is that I want to say it's 94% of teachers in the public school systems are white. Obviously, that's not the demographics in students, right? And so, you know, I went to a school district here, public school district here. It doesn't matter to call it out because the narrative is the same for others as well. But I went 13 years, kindergarten through 12th grade, and I didn't have a single non-white teacher in any of the buildings I was in, right? I mean, so I often talk about when you don't see someone who looks like you in a particular professional situation, you're less likely to aspire to being that. So the pipeline work that you also do is obviously super important. But I'm curious to hear a little bit, Dr. Shell, about sort of your experience, sort of related to what Dr. Hanlon was just talking about, you know, as you were going through your own training, you know, your own experience in high education, you know, levels. What did you sort of see or experience? Were you felt welcome? Did you feel, you know, not welcome? You know, how was that sort of as a process to actually filling out the providers, you know, making sure that we have people getting to that finish line and beyond?
Hello, can you all hear me? Okay, well, that is a very loaded question, but I will try my best. I got pieces and parts of it, so I'll just kind of jump in and chime in. So there's a number of things. I will start out by saying that it was really my doctoral experience that really launched me into just having an interest in doing my research that centers around working with clients of color, the marginalized, multicultural counseling, diversity, equity, inclusion, social justice, you name it. So that is where I really started in terms of my passion. I will share this as well. This is a book that I co-authored, and it is entitled How I Got Over, the Educational Pursuit of Black Female Scholars. And there's 13 of us who are doctors in different fields who, you know, we wanted to write about our experience. So I think that really speaks to what you just stated, because it is very difficult, especially being Black in the academy in terms of tenure, in terms of rank and all of that. But I also wanted to really focus in on working with the clients, the community. And that is why I wanted to start my private practice in Lancaster City, because quite frankly, you know, there were no providers of color who were in private practice, and I wanted to be able to give back. I know one of the things that I encounter and experience a lot is that clients will call me and they'll say, I can't find a provider of color anywhere. And like, you're the only one that I'm finding. And on top of that, you know, with availability, you know, because as Jackie stated, you know, there are waiting lists, you know, there aren't enough providers to fill that gap. So at any rate, my dissertation research focused in on, I wanted to know what the relationship was between racial identity, you know, how Black people identify, where they see themselves racially, how that impacts racial stress and what they experience. We all just, you know, the whole Black Lives Matter and the pandemic and everything that happened, like that really does impact us and where are we at. I wanted to look at psychological distress. I wanted to look at counselor preferences and does it really make a difference? And what I found in my research is that basically when it comes down to issues of race, clients of color, in particular Black clients, want a therapist that they can relate to, okay? Who has the same shared lived experience, who understands their culture, who understands their identity, who can assist them. So, you know, in terms of access and equity and all of that, we all need to keep that in mind. And we know that there aren't enough providers of color. That is why, and I might be tapping into another question, we have organizations like Patients Are Waiting, who, you know, they do have clients of color, in particular Black clinicians who are able to see clients and they're able to pay for that service. So I won't get too much into that because I think that's another question, but there are lots of resources to assist with that. So I hope I took a good stab at your question.
It's a conversation. So you take my question and you either answer it or ignore it, but you keep it entertaining and we're good. So yeah, I want to pivot a little bit. Giovanni, you serve on a committee here at United Way, an equity committee, and we all had just a happenstance robust conversation a couple months ago, and you shared a personal experience talking about mental health from a personal perspective.
Yeah.
And can you sort of share that journey? I just found that that's such a powerful thing that I was
Yeah. Thank you for allowing me to do that. 3 years, about almost 3 years ago, I would have never talked about this, just strictly on the stigma as a Latino man, as a Latino father, as the oldest of all the children from immigrant parents who came here for a better life. The stigma behind it is just very, very, very high. It continues to be so. But before I jump into that, even just what you guys were talking about right before this, you reminded me of, since I could remember anything, I've been a translator for my parents, even in a medical environment where a 6 or 7 year old should not be translating for doctors to their parents. So it exists, and it's not even just Spanish, it's any other language, multi-language families, or different backgrounds. It's a tough thing, and it has existed. There's lots of misinformation and things that fall through the cracks. So medically, it just becomes a huge issue because you can misdiagnose, mistreat, misinform. So that's very important. And even now, fast forward to literally yesterday, having a father in hospital who doesn't speak much English. Even then, we spent 24/7, one of us in the family rotated and stayed in the room with him so that we could provide the best communication possible. Because even though there are translators, and we're grateful for that because they have come in very handy lately, it's still very difficult when, your family member's mumbling, or you may understand certain dialects. We're Colombian, so we don't speak, the typical Spanish that maybe Lancaster's familiar with Puerto Ricans or Dominicans being the majority of minorities within our Latino culture. So anyways, those are all, we can go on and on and on about this. But specifically with mental health, I was exposed to it early on, many years back. My wife and I are raising my niece. She's now a senior in high school as well. So we're ready for that journey. She's going on almost 18, but she came over with us when she was about 4.5 years old. And back then it was even more difficult because I had to learn about mental health and support and guidance. And we then have had her in therapy since, because there are things that she has to cope with and deal with, and things that we need to understand how to deal with. I'd say 95% of the time, you're not going to get this kind of reaction or action from men of color. And it's unfortunate to say, because of the stigmas, because, we were brought up and raised thinking that you go to a therapist because you're crazy, and you get medicine because you're crazy. And I don't need that. I'm not crazy. Literally, until I became an adult, I had to learn that through a loved one who went through mental health struggles. And I was that person they leaned on, but neither one of us knew how to address it or deal with it. That's how I got to learn what anxiety was and what depression was, and what severe depression does to someone and puts them in bed for days at a time, or anxiety, making irrational decisions. So again, I had to learn all that the hard way, because I was always like, the heck, like, there's nothing wrong with you. Well, just because there's physically nothing wrong with you doesn't mean there's not something going on in your head. So we've been exposed to it for a long time, but on a personal note, right before the pandemic started, I literally had a heart attack and I died for almost 2 minutes at 38 years old, which is a whole other fun story to tell. But I was at a soccer game. It was right before the pandemic. I felt weird, ended up at LGH, thank God, because they saved my life. I did have the heart attack. I went down for almost 2 minutes. They had to resuscitate me and shock me back to life. And literally the next day was when they shut down everything in Pennsylvania for the pandemic. So anyways, that was right around then. I was going through a very stressful time, just personally, professionally, and just all the above. And I think that had a lot to contribute to it. But I had just started to see someone through my EAP benefits. So back then when I worked at an actual, I had a full-time like corporate job. I used the EAP benefits. So if anyone doesn't know about that, research it, use it. It's a great resource. I've used it for many things, for attorneys, for any kind of anything. It's available for whatever. So I used the EAP benefits and was seeing someone, and then realized how deep the scars were, how serious some of my mental health issues were, even though I felt I was very grounded and like with it and nothing was wrong. I then understood sometimes that I would get through some depressed episodes or depression episodes or anxiety episodes, just being able to talk through it. I learned a lot about myself. I learned a lot about how mixing cultures is a major traumatic issue in our society, because there are beliefs and disciplines that come from another world. Then you come to the American US system, and then that's a whole different world. So that's a mix of identity. So I've realized how tough that was my entire life growing up. I grew up in North Jersey where everyone looked and sounded like me, and then my family and I, we all moved here to Lancaster County in New Holland when I was 15, so a sophomore in high school. That's where I learned what racism was. That's where I learned what inequities were. And that's kind of what started me on my whole advocacy side of things. I didn't realize what that was like to be a minority. I didn't even know what a minority was until I was 15, 16 and getting in the fights with people calling me racial slurs or hearing them use the N-word freely and comfortably. So again, all of that has allowed my journey to kind of learn and grow from it. So this mental health thing for me has been very important, even to put myself in this vulnerable position that I'm doing right now. This is something that no one I know would do. And the funny thing is that I'm starting to see some of this change within my circle, within my immediate circle of men of color who are getting a little more comfortable. I told my friends I love them the other day. Like that's something I've never done. And those two guys mean the world to me. And if they ever hear this, Eddie and Samir, I love you guys, man. You guys have been my brothers since the day I moved to this state and through all my difficulties and great moments. You know, I wouldn't be able to say that 2.5 years ago, ever. I wouldn't be able to say this to any other person, including myself. You know, give myself the talk ups that I need sometimes to motivate myself to get out of bed, to go do something, to handle this, you know, whatever life brings at you. Literally at the very moment, my father unfortunately passed yesterday. We've been in the hospital for the last 2 weeks. It was a long battle with cancer, but we were able to love and appreciate the moments we had. But even now, I don't think anybody would have guessed that we're literally in the middle of, I was writing an obituary as we were prepping for this earlier, trying to wrap that up to submit it to the funeral home. But all those things that I would have never talked about. And that's what it comes down to. I want to, if anyone's listening out there and you take anything away, please encourage these men of color to talk about it, to deal with their scars. There's lots of scars and lots of issues, even small or big, no matter what that is. Have somebody to talk to, deal with it. And even the journey to try and find a mental health professional of color was difficult. So I now go to a Black man who's as old school as can be and has such a great understanding of where I'm coming from, even though he's not from Colombia, he's not Latino, but he grew up in a very similar traumatic environments. And not to say that our parents were terrible and that, all this was bad. It's just that when you compare it to reality, there are sometimes things that are very traumatic to children that you may not even realize you're doing. So now, of course, I'm like the worst with my kids because I literally hug them and kiss them. And my almost 15-year-old, who's now a freshman, walks in the door. He's taller than me. I literally grab him and I kiss him and I hug him and I tell him I love him. And he's like, Dad, come on, man, like get off me. But like, those are the little things that help you as a young Latino growing up and minority growing up in this country, especially during these times. So I know I've gone on forever and I apologize, but we can go on even more. So please reach out if you guys want to hear
Giovanni,
more.
first of all, like our collective sympathies on the loss of your father, even
Thank
if
you.
it was a long battle. Obviously, that is, formative in good and bad ways, dealing with those challenges that are life, which is life itself. And so, just a thank you for the vulnerability that you just shared. I learned vulnerability because I studied theater. Like it was a back channel into empathy for me, right? Because growing up, you're tough. Don't do your sports team photo. Don't smile. Nobody smile. Nobody smile. Don't smile. Like that.
Don't cry.
Don't cry. It's constantly reinforced. So thank you for both just your story, but also the example that you demonstrated. And I think, as you said, it's so important for us to encourage, particularly men of color. Honestly, men, like just first of all, men, like broadly, and then particularly men of color. So it's like a layer type of thing.
Yeah, there's It's more. There are more layers for sure.
When I worked
in general.
I worked at a church as a pastor at one point, and my supervising pastor, he said, the thing that he did with men for a long time, he tried to get them in the same kind of like fathers groups like the mothers groups had, and tried to put them together, and he couldn't get them to talk. And then he realized whenever they went on like a trip to like paint a house, he said, if I put a paintbrush in two guys' hands beside each other, all of a sudden they'd start talking in ways that if I sat them down and said, hey, let's talk about our feelings, would never happen. So it is, you got to find those different ways. Speaking of sort of the pastoral space, Mandy, and I've loved watching how you do ministry that is right, that your objective is the person in front of you, and it's not trying to convert them or get them to believe in this, whatever. You literally take a person in front of you and you address what they have in that moment. Can you talk about both sort of how you have learned about and dealt with supporting the wellness that you've encountered being across the street from Ben's Park and the community challenges there, but also the aging side of that, because your church chose, right, to literally put its resources, sell its building, and move into a space that you could host an adult day program. I did see Dr. Randolph had asked about EAP programs, and I saw there's an answer in that Q&A section, but an employee assistance program. So if you work for a company that provides you health insurance, more likely than not, they probably have an EAP, and it's something you can ask your HR representative about. But it's all the employee assistance stuff that's available, that may provide free counseling sessions, up to a number of them, or things that are outside of just your usual thinking of health insurance and doctor's visit. It's a lot of other ancillary support. So reach out to your HR department or representative if you have one, to ask if they have an employee assistance program. If they do not, we often talk about our 211 contact center as being a form of community EAP. So if you do need help or support around any of these or other issues, and you don't have supports formally through an employer or some health provider, please reach out to 211 online or via phone to find resources that are available in the community. So sorry, Mandy, I remember I wanted to clean it up. Go ahead.
I think I'll start by talking about the Adult Day Center. And as Kevin shared, Lancaster Moravian Church was out on Eden Road, out in the suburbs. But prior to that, starting in the 1700s and going on through the beginning of the 1900s, was here in the city, moved out to the suburbs, and then started looking at what it should be doing in the community, started facing some questions about decline, and realized that they had a heart for seniors and for senior care, and decided to sell the building and use the proceeds from selling the building to start an adult day center. We are the only standalone adult day center in Lancaster County that's not associated with a larger retirement community or entity. And we serve individuals from all over the county with a variety of memory support needs and other assistance and activities of daily living. we are a pretty diverse group as far as our clients and our staff are concerned. We have a number of clients who are only Spanish speaking, and so we always make sure that we have Spanish speaking staff here at all times. And we also try really hard to make sure that we have 5 different paying sources, and we try to make sure that there is equity in those, and in the way that we are charging and serving, that there are no services that are provided to any one particular payer source that are not provided to other payer sources, to make sure that our individuals who are living in lower socioeconomic status, that they are able to receive the same benefits and programming that all of our other clients do as well. Right now we have about, on any given day, we have about between 20 and 30 clients who are here that we serve. So that is our adult day center. Kevin, what you were sharing as far as the work that I do personally from a pastoral and a social work standpoint, we are a block from Binns Park. And so when the church came here into the community, it came here predominantly with the purpose of serving the adult day center, but it didn't take the congregation long before they realized that the Church of Lancaster City from the 1940s and 50s was very, very different than the church that would be in Lancaster City in 2015. And that there were a lot of different needs. And being above the bus station, we see a lot of individuals who are coming in asking for requests for food assistance, for assistance with transportation, who are dealing with issues of poverty, issues of addiction. And the congregation said, we don't just we want to be a part of this community. We don't just want to be a suburban church worshiping in an urban setting, which is what they kind of started out as, but we really want to be a church that is involved in the community around us. And so I do a lot of social work. I do a lot of listening to people's stories and having them share with me what's going on in their life. Usually the 2 questions that I ask of almost every person are to share, please tell me a little bit of your story. And then before a person leaves my office, I always ask them if they want a handshake or a hug, because developing personal relationships with folks is so very important.
Thank you. And as a person who's got a master's of divinity, and it is so refreshing and inspiring to hear you thinking about wellness as whole body, whole person, right? Not sort of compartmentalized. A couple of weeks ago, I had heard an individual who was a patient at one of the medical providers, one of the institutions in this community. He himself is a gay man and was struggling to find a practitioner who was sympathetic to who he is as a human being. And this was not the first time, and became very frustrated and walked out like in the middle of a treatment, and ended up walking down the street, very sort of distraught, not sure what to do. And they saw this place called Union Community Care. And they walked in and told their story and asked to be served. And Union met them with who they were and where they were. And they have since begun to go to Union as their primary care. Jackie, can you talk to me about what makes a federally qualified health center a little different? How does it sort of interact with the person who's in front? What kind of training or sort of how do you create that environment that someone walks in and doesn't feel the kind of social pressure or judgment that they often feel when they walk into other places? I like asking unfair questions to answer.
I'm glad you bring that up, because that was something I wanted to talk about. Was what makes a community health center is that we're part of the community. We try to employ most of I think it's a little bit over 60% of our staff are employed in the community. And the reason why we do that is because we want people to be invested in our vision. And when we hire, we want people to be invested in the work that we do. So we don't just want to hire, I mean, sometimes we have to hire, especially when it comes to those higher level positions. But in our interview process, we make it a priority to really try to get people to understand the community that we serve, that we're not just a healthcare program located in this place, but that we are really invested in serving that community. We want to be part of that community. One of the most recent changes that we have done organizational wise is we started this thing called the empowerment model. The empowerment model involves people being empowered to do the right thing, to do the work that they want to because they want to, not because they have a supervisor right next to them. So we've eliminated a lot of supervisory positions, and we are saying to people, we want you to be empowered to do your work. Managers manage expectation, but people manage themselves. So if you come in to an interview with us, we're going to ask you those questions. We're going to ask you, hey, so what motivates you to want to work in this community? Not just Union, but this community, Lancaster City, if it's in Lancaster City, if it's in Lebanon City, or New Holland, in the, more the rural areas. So we want people to work for us that really represent the community that we serve. And I think when you start sort of moving towards that agenda within your workforce, you're going to see people that really care about the people that they serve, because these are their neighbors. These are the people, the abuelita that lives down the street, or my cousin. He hasn't been able to go to the doctor, so I'm going to send him to Union. And we want to empower our staff to value that, so they can then empower the people that they serve. And we're having a lot of success with that. I'm having such a great time doing this, because what we find is that, a lot of people work in organizations for a job and a paycheck, of course, but they also, because they believe in something, they have this certain value of wanting their community to be better. So we're trying to marry that. And what we've done also in line with equity, health equity, is that we want our staff to feel that they work for an organization that cares about them. So we've increased our salaries to start at $15 an hour. So no one in our organization has to earn less than $15 an hour. We invest in our employees with resources, but also we are putting initiatives, and that if we have certain goals in our organization, and if you help us overcome those goals, guess what? That pot of money is going to go right back to our community. And investing in a mobile unit so we can get to all the schools and provide dental assistance, dental care, get a mobile unit to go out to some of the rural schools that it's hard for people, to get transportation. So when we start awakening those ideas in people that you have a purpose, it's not just a job, it's a purpose, and that you're going to be part of something bigger and better, you're going to find that a lot of people really want that. They want that for themselves, and they also want it for their communities.
Thank you. And Jackie just referenced the mobile unit, just so the twinkle in her eyes that United Way has been able to provide a grant through our Level Up and Launch grant process event tomorrow night. If you're looking for something to do at TELUS 360, I think we still have some spots open. But this grant, so they applied, and we gave, I think, about $38,000, and it will match dollar for dollar contributions to that mobile health clinic. So if you're looking for something to contribute to supporting equitable distribution of healthcare provision in this community, please go ahead to United Way's page, look for our Level Up and Launch events or opportunities, and give a gift to Union through that. We'd be glad to match that. So I do appreciate you thinking about that sort of mobility thing, which is often a challenge. Sort of on house populations, but also those rural populations. It's kind of a commonality for people living in low resource poverty conditions is a lack of ability to get from place to place and the challenges that brings. Dr. Hamblin, thinking about the sort of, again, the community of caregivers, what are, so being able to get education or get access to it is one thing, right? You talked about your 3 priorities. And the second one, I'm curious to hear from you on, you said leaking, right? It was first getting the professionals, the pipeline, and then keeping it from leaking. Help me understand, what do you mean by a leaky pipeline?
Yeah, so it's interesting. One of the other panelists was talking about, the desire, right? So we might think that people you have to get more people interested in becoming a doctor or becoming a dentist or becoming a therapist. There's some of that, but most people know what a doctor is, right? What the difference is that when a Black child says, hey, I want to become a doctor, there's 25 people standing in line to tell them that no, they can't. Maybe you can't. That might be a bit much. I don't know how you did in science. Sometimes it comes from even in your own household where it's like, you got doctor money, how expensive school is going to be and all of that kind of thing. But beyond, it's so I think that one of the things about pipeline leak and saying, if we recognize that it's so important that we need to farm the home team, that we need this outcome, we looked at it, you said there's 309 dentists in Lancaster County. If we say, look, in Lancaster County, we need to grow 30 dentists per year in order to reach this need, then we should be funding and doing things to say, hey, we have these middle schools. Every middle school is going to know exactly how many teeth they have in their mouth, what an endodontist is, just make it something that's fun and important and part of their daily life, because we're trying to grow dentists, right? Pipeline leak happens because there is a disinvestment in human resources, in the human capital and the potential of Black and brown youth. And so whether that happens because of being told no how many times until you finally say, let me not speak up about that, let me hold this close here and quietly, whether it is because an advisor or a guidance counselor doesn't see that potential and then tell that student, you should try to do this thing, whether it is because of our schools, and based on your zip code, that's going to say what school you go to. That's the biggest factor, what AP classes are offered, what advanced placement, and what level of rigor there is for you academically. That's going to be based on where you live, what resources your parents have. And so those things. And then when you get to college, going through for medicine, dentistry, any health career, there's a lot of information that you need, not just the book knowledge, but just to know what the steps are. So if the collective understanding in your social circle is nobody's done this before successfully, then there's less collective knowledge of these are the order of the courses that you need to take. Even if I had that information from a pre-med advisor and I'm told, well, you should take this in the summer. Well, if my financial aid doesn't go to the summer, so now I have advice that doesn't work for me, but I may not have enough agency to ask the questions that I need to ask. And I don't know what I don't know. And so you see college students from Black, Latino communities enter more saying that they want to become health professionals, and the attrition is more stark. So the interest is there, but it is the leakiness, and we can't afford to have all of these youth who express a desire to be health professionals. We can't afford to have them change their mind, go off course, and go to something different. And I say change their mind as in, I meet people at least 2 or 3 times a week who finished undergrad, have some kind of degree that's not what they went there for, and they are clawing their way back to a career in medicine. And it's expensive, and patients die because of it, excess deaths. It's unreasonable to me. And I think that the similar lines can be drawn for many different industries, but medicine is the industry that I'm in. And so, I think about it, the same thing that you said before about teachers. If we can look at it and say, well, look, 92% are teachers, then why don't all of the, state schools have a minority teacher program where you have a full scholarship to go to school to become a teacher if you are what is missing in the education profession?
Right. So it's about prioritization. And one of the things I was thinking about as you were talking is, I think almost every person, except for maybe some delusionally confident people, right? Every person at some point has imposter syndrome, right? Like, it's just a thing that pops up. Like, do I really belong here? Like, did I earn this enough in X, Y, and Z? That is almost, it seems just sort of natural. Like, it's almost innate. What you're talking about is then you have layered on top of that social additions that sort of like build up that imposter syndrome, right? Hey, you're not that great at math. You're not that great at science. Like you've always struggled at test taking. So now you've got your sort of natural sense of like, man, did I really earn this? And then you've got society around you saying, no, you didn't, or no, you can't. And so I think that's, from a relatability standpoint, I think a lot of us understand that imposter syndrome. And then for those of you who have not had the experience of a whole society telling you that there's an entire history that claims that you are less intelligent because of the color of your skin, what that adds on top of that. Mike, we have a question from Mike Shook, which asked if there was any sort of concerted efforts to promote CHIP and assist folks in enrolling. I'm going to ask Jackie if you know of anything in particular that helps people get into some of those, how individual people have access to affordable care.
So at our community health centers, at all of our sites, we have right now about 10 social workers. And their primary role is to assist people with getting health insurance. So if you come into one of our sites or contact or call and say, hey, I need health insurance, they'll connect you to one of our social workers or community health workers, and they will call you, look at, assess what service, what programs are available to you. So it could be CHIP, it could be Medicaid, it could be the marketplace. So there are a lot of different options to get health insurance. It's a matter of navigating the system. And it is not that simple. It's an application process, and they will walk you step by step through that process. So I encourage you to call.
Thank you.
Any of our sites.
And so for anyone who knows of someone or you yourself may need support, there's a direct resource that you can direct people to. Dr. Schell, on that similar sort of conversation about access, I know that in my life, I didn't have health insurance until I got a job at United Way. I didn't have it provided by any of my employers until I got to United Way, January 2020, which I was probably like 36 years old, 35 years old. None of my previous employers, largely because I worked mostly in the nonprofit sector and particularly small nonprofits, so that wasn't sort of provided. But in other experiences I know from other people who have had insurance, oftentimes mental health sort of counseling is not provided as part of of that package. How does access sort of play in from a patient side? What are there sliding scale providers? Are there it's such an important issue, as Giovanni helped us understand, particularly for men of color and other people of color. Is it a lack of access though when someone finally comes around and says, hey, I want to do this? What are some of those challenges and how can we overcome them?
Yeah, it's a huge challenge. It is definitely a huge challenge. In my experience, I can speak to my experience. So you have different categories or different levels. So you have the clients who come to you who have insurance, but they have very high deductibles. So in a sense, they're not really getting any benefit from their insurance because they have to pay out of pocket until that deductible is met. So that's usually the case when it comes to mental health. You do have some insurances, like more of the Medicaid, of course, where they, can get 100% covered. But you do have some other private insurances that have copays and things like that. But then you have the largest, and from my experience, of clients who come and they don't have insurance at all. And so oftentimes it's, do you offer a sliding scale? And absolutely, yes, we offer sliding scale. There is an organization that is called Open Path that I refer all of my clients to who don't have insurance, because with Open Path, they can find a therapist to work with at a nominal fee. So that is one of my first go-tos, and there are lots of resources and things of that nature that Open Path offers as well. Other than that, we have a ton of resources right here in our own community here in Lancaster. As I was stating, we have Patients Are Waiting. I'll let Dr. Sharice Hamlin talk more about that. But we also have through the Mental Health America offers also another really good EAP plan where they will help. I think the mission is first responders and other organizations. They may have expanded it to everyone who doesn't have health insurance. We also have, well, actually, this isn't a Lancaster thing. This is a Black and Brown thing, but the Boris Henson Foundation, the founders Taraji Henson, will fund up to 3 to 5 sessions for Black and Brown individuals as well. So there are a lot of resources. It's just a matter of people really reaching out and getting the help. I know Steinman Foundation has been phenomenal in awarding lots of different grants. I'm a part of a supervision collaborative right now, which that grant is funding clinicians to get licensed to help our youth as well as other individuals who need it. So there are lots of resources. It's just a matter of reaching out and getting the support and getting the help. So when clients call me, I try to get the background information and try to, refer them to those sources that will best help them.
Thanks. And yeah, Mental Health America has a Lancaster chapter, but if you know someone who's outside, Mental Health America is a larger sort of federated nonprofit structure. So you've got a cousin in, Des Moines, that's potentially, I don't know if there's a Mental Health America in Des Moines, but, potentially they may be in other communities outside of Lancaster. And yeah, we've worked with them extensively over the years at United Way. The Mental Health America partners with other resources like Compass Mark, and there's a lot of resources in Lancaster around this, just making sure that you all sort of connect with them. And again, if none of the things fit you that you've heard today, just again, a reminder that you can call 211, they'll be able to find hopefully where you need to go, but always go directly to an agency if you know who they are first.
And Kevin,
Yeah, go ahead.
I wonder about this, and I put 2 links in the chat just as we were talking. It's really interesting, and I think that we have such a unique community here where there's a robust nonprofit or community and a network, and so many things will kind of overlap and kind of come together. And then we have this collation of what are the needs, how are we doing as a community. What I don't see is that vision of where are we going? And some of this, I think, with the Steinman Foundation and some of the work they did with the STEM Alliance, you see this forward thinking of how do we want to kind of engage as a 10 years from now, what's the future of this? And it seems like we have very defined priorities and needs that need to be met, but then community members have to piece it together, and that's it's just kind of sad. It's kind of sad.
Yeah, it's the work that we see in workforce development, for instance, has some coordination right now with the Career Ready Lancaster, and you've talked about sort of this, both Steinman and STEM and some other things. But it is sort of this difficulty, right? Who's the one responsible to step up and to lead that? Do we support that? I mean, one of the things that is great about Lancaster is that we have hundreds of really viable nonprofits. One of the challenges is that we have hundreds of viable nonprofits, right? So, I'm going to fund the thing I love, and not necessarily understanding that there's a wider breadth, a bigger picture that can be pieced together. And so you've got, it's excellent, great for an organization that has, $10-15 million endowment and is sustainable forever, but you've got an organization over here that's either starting and fledgling or has been around for a long time but never had the resources to get over that hump. And it's sort of this challenge of looking at an extremely abundantly wealthy community that has sort of what almost feels like unlimited amounts of resources to solve problems, but often they're solved in point, as opposed to big picture. So, there's probably some level there that is our responsibility as an organization. That's part of what we try to think about and address. It is certainly a challenge. But I will say that that's one of the things I'm speaking of Mental Health America, outside of the like direct service work they've been doing. There are pockets of people like Kim McDevitt has brought together a conversation that I'm a part of by her invitation to think about how do we respond to non-emergency sort of phone calls that right now go to 911 that are really about like mental health or other things, because we know that too often the wrong solution to a particular problem leads to even worse outcomes, right? So we've seen, how many times have we seen police officers show up at a mental health crisis and an individual ends up dead, when if we had sent a counselor to the same situation, that may not have been the outcome, because it's the wrong solution being applied to a particular problem. And so Kim and her group have been trying to figure out with police officers and others, how do we sort of reroute that in a more effective way? I think it's a great challenge, one that I certainly feel personally directed towards with that in our work here at United Way. But that coordination, the deduplication of services, but also just the coordination, is a really important component of community success long term. So I want to ask you all, because we have about less than 15 minutes left, and I'll start with Giovanni, just because we haven't heard his voice in a little while. I'm going to ask each one of you to challenge. I'm going to play off of what Dr. Hamden just sort of brought up here. I'm going to challenge each one of, or ask each one of you to challenge the community in something that we could all do, that we could think about as an individual person or from a systemic level. What's something that we can do to sort of improve wellness for Lancaster community? What do you want to challenge this audience?
Man, that's a loaded question. I think that the takeaway or the challenge would be to just support people. Like, you never understand the layers of things they're going through. It all may look pretty in the face of it, like, the front or the picture, even through social media. But you never know what's really happening. And, try and be supportive. Like, if you're having a bad day, don't bring somebody else in with it. Like, it's not their fault. Make it a good day. And try and just pass that on. Like, try and just keep positive with people. Help talk, like, just talk about it. I think that's a big step, especially like the situation I'm in specifically. Seeing everything that everyone's talked about already, like growing up that way, not having insurance and living off like welfare as a kid and WIC, and being broke and not having resources and just not having any of that. I think just educating people around you, like, don't just assume everyone knows. Make sure you pass that on. Share the wealth, share the knowledge of wealth, or the wealth of knowledge. Sorry.
Thank you. Mandy, we'll hop over to you.
I would say get to know someone's story, like really get to know someone's story, and especially someone who challenges you or someone who is different than you in some way. The world can open up for us and for another person when we invite them to share their story. From a spiritual perspective, I personally believe that when we invite someone to share their story, and we openly listen, so that there's a generosity of giving and receiving in that, for me, those are sacred moments, and they're moments that we all grow from. So just get to know people's stories.
Thank you. It's a good way to develop empathy. Dr. Shell?
Yes, I am going to really stress self-care. And I know that it has become a big buzzword, especially since the pandemic, but it's so important. It is a way that we can prevent a lot of this from happening, taking good care of ourselves, reminding ourselves, even us as professionals, as providers, as doctors, we have to take good care of ourselves. We cannot help others unless we are fully functioning. So just a reminder, just to have balance. I know we're all workaholics, and I know we have great aspirations to save the world. But guess what? If we're dead, we can't do any of that. We need to be able to leave a legacy for our children, for future generations to come. And that starts with really good self-care. So something very simple as just saying, am I balanced? Just a quick check-in, looking at the mind, looking at the body, looking at the soul. Basic things. Did I go to my provider to get my annual physical? What are my numbers? Did I eat today? Did I eat 3 meals a day? Did I drink water? Did I get enough sleep? Like, these are basic things that we can do to check in with ourselves to make sure that we're having balance, because when any of those parts are off balance, then, we don't function fully. So that is my challenge to myself and to all of us, is to practice really good self-care.
Thank you. And in my case, did I eat 5 meals instead of 3? That self-care is sometimes about limiting, right? How do we not do excess? Dr. Hamblin.
So I feel seen, Dr. Shell. I didn't need that. My challenge is for all of us on the call to think about how we can kind of put our arms around the Lancaster community. And I'm being very specific, Lancaster City. So that idea of, if we raise the floor of what's acceptable to us, what we think is reasonable for how we live as a society, as a community, right in this small city. And so if we're thinking about that, and then you say, what's the bare minimum that I can live with and sleep at night, and then apply your work to making that minimum something that you can live with.
Sorry, couldn't click the unmute button. Thank you. Yeah, I think that's right. Let's stop writing people off. Let's stop accepting minimums for others that we would never accept for ourselves or our families. I think it's raise the floor. Thank you. Jackie.
I'm going to just go on what we are doing in our organization of really raising the expectation that although we serve a community of underserved or of the neediest, that we should expect to give them the best care possible. So one of my goals is I'm in charge of making sure that our patients get a red carpet treatment. They get the best treatment from the time they pick up that they get that phone call to the time they come in. We treat them the best that we can. And when we start doing that, we start teaching people that just your zip code or your circumstances should not determine the care that you need, that you get. That you should get good care regardless of your zip code or the condition, or if you're depressed or if you're not. Let's work towards giving people that red carpet treatment, the best patient experience possible, so they could value that. Because if I walk in and my doctor cares about me, and maybe I was so depressed to not realize how bad my condition was, but maybe now my world opens up a little bit, and I can have those conversations. I can open up a little bit. I think that many times areas like Lancaster City, there's sort of this expectation, they get what they get. Well, no, they don't get what they get. They should get the best of what they should get. I shouldn't have to go, 3 blocks down or down to another provider because here I can't get what I want, what I need. So being the best at what we do at all levels, it should be the expectation.
Thank you. For me, I've been thinking a lot this week because I had a little Facebook post that sort of blew up because I talked about student loan forgiveness. How do we begin to see our fellow Americans not as our enemy, that when they receive something good, we celebrate it? And also, frankly, in a self-interested level, recognize that when you have a society with a floor that isn't so low, that also raises your ceiling. Like having community members who are financially well, who are health well, who are otherwise well, actually in the end is the best thing for you as well. If you don't support public education funding, you don't get to complain in 20 years when crime rates go up. Like you caused that, right? Right. Like so these things are not disconnected. So I just want to challenge us to remember that things are not disconnected and that it is okay when someone else has a benefit, even if it's not necessarily a benefit that you personally are getting. It's objectively okay. And in many cases, we'll come back to support your own wellness as well. The other thing that I want to just encourage all of us to do is think about how we spread the things that we're passionate and interested. So if you enjoyed this conversation, just email the link when you get it to one or two people, right? Like, don't be so afraid that someone may not like the things that you like, whether it's community support or otherwise. Like, give people the opportunity to choose to be part of things that make our community better. And in that too is this fun one, which I've been saying recently, which is that the cost of gas is going up, cost of your medical providers is going up, the cost of your mortgage interest rate is going up. Everything's going up because of inflation. Is your contribution to your favorite nonprofits going up too? Because I bet you it's not. And so I want to encourage you, as everything else is going up, think about how is it that you're giving out of your abundance to those who are serving or directly in need of services. And so please also think about how you're continuing to think about supporting organizations like United Way, as well as others represented on this conversation and the many others that all of you, I know you have at least one charity that you support. Can you give them an extra $5 this month? Can you do that recurring? What can you do to help others in this community? Thank you all for your time. Thank you all for your attention. I deeply appreciate every single one of you on this panel, but also every single one of you on the other side of the screen. Thank you for making Lancaster the excellent place that it is in all the ways that you contribute to our community. And we hope to see you again next month for our communities about our conversations about our community. Thank you, everybody.